Organisation has declared a swine flu pandemic, the first influenza pandemic in 40 years. The alert level is now at the maximum of 6 after a sharp rise in infection levels in Australia, the UK, Japan and Chile. But while the number of people with swine flu is continuing to rise, the WHO says the H1N1 virus causes only mild illness in most people.
It's official, we're in the midst of our first flu pandemic in 4 decades.
The world is now at the start of the 2009 influenza pandemic.
Despite the declaration, the World Health Organisation says it won't recommend closing borders or restricting the movement of people or goods and services.
The virus is spreading under a close and careful watch. No previous pandemic has been detected so early.
Reaching 6 on the WHO scale doesn't mean the swine flu virus has become more deadly, but it will trigger heightened health measures in 193 countries.
Phase 6 doesn't mean anything concerning severity. It's concerning geographic spread. So we have to differentiate between the two.
H1N1 is making its presence felt throughout Asia just weeks after the outbreak began in Mexico. In Hong Kong, a number of students returned positive tests, and with the source unknown, the government has acted quickly.
All primary schools, kindergartens, childcare centres and special schools will suspend classes.
In Australia, the number of swine flu victims has jumped to more than 1,200, the 5th largest number worldwide. 5 people are in intensive care, though the government is playing down those cases.
Those who are hospitalised generally have been had other existing conditions and complications.
The Philippines has confirmed new cases. China too has been warned to brace for a surge in infections.
WHO would also advise China to make sure that the healthcare facilities in the country are well equipped.
In all, there have been about 28,000 infections reported in 74 countries. 141 people have died. Natalie McGregor, ABC News.
The sharp rise in swine flu infections in Australia was instrumental in the WHO's decision to declare the global outbreak a pandemic. Prime Minister Kevin Rudd says health officials will meet today, but he doesn't believe there's any need to change Australia's response.
Our national responsibility is to make sure, among other things, that we've got an effective supply of antivirals, Tamiflu, Relenza. Per capita, we've got the biggest supply probably, or one of the biggest supplies in the world, and to respond to individual state demands to make sure that's been distributed effectively from the national stockpile. I think in terms of preparedness, we're okay, but let's look at the fact that Australia is a highly mobile population. And a lot of Australians travel internationally, and as a result, we've got some challenges to deal with. The committee which deals with this, involving Commonwealth and state officials, will be meeting again this morning to look at the WHO's overnight change in the global status. We need to work through this calmly, methodically, step by step.
And that was Australian Prime Minister Kevin Rudd.